Hi, and welcome back to another episode of Getting to Know You. Today, I'm joined by Dr. Megha Tollefson. She's a pediatric dermatologist and professor of pediatrics and dermatology at the Mayo Clinic. She's been with PeDRA from the beginning and participated in some of PeDRA's founding meetings. And she served on several committees and chaired PeDRA's membership committee, and now is a member of the board of directors. Thanks so much for joining me today, Megha.
Yeah, thank you, Jen. It's awesome to talk to you and to be here today.
Thank you. So could you tell everybody why pediatric dermatology?
Yeah, that's a question I get asked a lot, actually, by residents and medical students and actually lots of people. So it's always a fun one to talk about. I think kind of in my peer group of pediatric dermatologists, I think most of us identified that we really just enjoyed taking care of kids. And pediatric dermatology was certainly a field when I was going through training, but I don't think one that many people knew a lot about. And I happened to find a role model and mentor during my pediatrics residency who kind of introduced me to the field and just really got me very excited about pediatric dermatology. And I think, through that, I discovered the joy of taking care of these kids. And then also just being a part of this larger community of pediatric dermatologists, just incredible people that work so well together, that love kids, love each other, and just work together so well.
I was just talking to Dr. Siegfried and she said the same thing. She was just inspired to work with kids and then became inspired by a mentor to go into dermatology. So it's something I hear out of almost everybody in the network, really.
Yeah. And, it's something that I actually think a lot about as I mentor residents and medical students and fellows.
Yeah, I bet. So you're a very active pediatric dermatologist, but then you also do research. So what got you involved in research?
Honestly, it's very similar. It was mentorship. Research is something when I was training, I thought, well, I think I'd probably like to do some of it, but I never thought that it would be a focus of my career. But I think a few things. One is, just being curious. But the main factors were the mentorship that I had in mostly in pediatric dermatology, and then just the ability to work together with all of these pediatric dermatologists through networks like PeDRA. It's inspiring. It gives me passion, and it's really fun to see the end results.
I agree. I love watching the inspiration take place, particularly at the PeDRA meetings, but then also in the small sessions we've been managing to carve out with the focus work groups over the year on Zoom. Can you talk a little bit more about your specific research interests and what you have going on for research right now?
Yeah, so I actually have a lot of interest, I'd say, within pediatric dermatology, but the main areas that I focus on right now are vascular birthmarks and vascular malformations. We're involved in a few PeDRA studies in that regard, but also some studies kind of here within our institution. I've been able to collaborate a lot with the connective tissue group in PeDRA, who's been a really great group to work with, very kind of team oriented, and been able to dive into some topics that need a lot of attention. And then probably, the other things that I focus on a little bit more are psoriasis and atopic dermatitis. So really working within the inflammatory skin disease group, working at, within PeDRA, but also here. Another thing that I've done a little bit more of recently is gotten involved in clinical trials in pediatric dermatology. So that's been a really exciting, steep learning curve, but a lot of fun to get involved in too.
Yeah, can you talk a little bit more about that?
Yeah, definitely. So the clinical trials that we've been able to get involved in, some of them are actually we heard about through PeDRA, which was really fun. But two exciting areas right now in particular. One is atopic dermatitis. There are so many medicines, so much development going on around atopic dermatitis with the biologics, the JAK inhibitors, topical medications, things like that. And so we've been able to get involved in a few of those clinical trials and really offer alternative treatments and options for patients. So that's been really, really fun to be a part of. And then the other piece, the other clinical trial area is in the vascular malformations realm. There's one clinical trial looking at a topical medication for vascular malformations that we've recently been involved in, which has been a really great, promising study to offer as an option for patients as well.
That's really exciting. So how has research changed over the course of your career? I know just in like the few short years I've been involved with PeDRA, it seems like it's really accelerated like pretty dramatically in the last couple of years, especially like you said in the AD space. But I just, that's my perception. And I just wondered what it's like for you and how research has changed.
Yeah, I agree with you. I think it has, research in general and in pediatric dermatology has changed a lot since I got involved and interested in it. I think early on in my career, mostly people were describing conditions, doing, retrospective reviews, things like that, which were great and important and very important even for mentorship purposes. But as time has gone on, that's really changed over time. I think people are still really good at doing those, and those are important as well. But through networks like PeDRA, I think, you get excited about other types of studies. You have a network where that's more possible. And so I've been seeing more multi-center studies, which really have a richness, even if it's retrospective. Prospective registries have really increased. Prospective observational studies we've been able to do more of, especially through the PeDRA network. And then now, we've gotten to a point where even interventional studies. And so, to be able to offer different treatments and medications to children with skin diseases has been great. So yeah, just a huge shift. And I think there is a purpose and a opportunity and an avenue for each of those different types of studies. But it's really great to see them all happening in pediatric dermatology.
Yeah. Is this what you and the team envisioned when you were putting together PeDRA all those years ago?
I don't know that I can take credit for any vision. I was fortunate to be a part of it back then, to be able to help. I think there have been just amazing mentors in pediatric dermatology that really had the vision, but I think, it kind of aligns with that these are some of the goals to get kind of more robust, stronger, bigger studies and to be able to do more of these, kind of prospective interventional studies, like some other, maybe similar organizations in other fields.
Yeah. How do you feel about involving other fields in PeDRA and the research that we're doing?
Yeah, I mean, I think it's so important. It's something we've really tried to do, and I think we've actually been successful at it. It adds a richness to get another perspective, and to involve someone who might know a lot about something that's related to your topic is so important. And also just to get knowledge out there of the field of pediatric dermatology, of what pediatric dermatologists do and see and research and study every day. That helps also. So, just growing the network of people interested in any way in pediatrics is great.
Yeah, I agree. I think it was really terrific when you and Dr. Eichenfeld and Dr. Tom and Dr. Davis had included Dr. Gang from Rady as an allergist in the atopic dermatitis series, because I think that, having that input with fields that are so closely aligned to the diseases that our patients are facing is so important.
Yeah, definitely. And, I learned too a ton from that. So it's really, it's very beneficial all around, I'd say.
I agree. Yeah. So one more question before we wrap up. What is the best piece of advice you've ever received, either in your life or your career so far?
Oh, that's a great question. That's a hard one. And I hope that I could maybe impart someday to others, but I'll say, at the moment, there's a quote that resonates with me. Anyone that knows me knows I'm somewhat obsessed with my Peloton bike. There's one instructor in particular who's very good at motivational quotes. And the one that is resonating with me right now is one where she says, "Purpose reframes the pain." So to me, it really just means, you're putting in that hard work and you have a purpose.
I think it's a great piece of advice. Yeah, that's perfect. I'm going to remember that now when my back is hurting tomorrow on my run.
Yeah, exactly.
Yeah. Thank you so much for joining me today, Dr. Tollefson. It was a real joy talking with you.
Thank you, Jen. It was my pleasure.
Thanks so much to Dr. Tollefson for joining me today. It was great getting to know her. Be sure to follow us on our social media, Facebook, Twitter, Instagram, and YouTube. And make sure to like and subscribe to our podcast channel, PeDRA Pearls and Getting to Know You. We'll see you next time.